So thank you so much for joining me. Like I said, I am Tiffany Roberts, and tonight we're going to discuss some of the reasons why you would want a health coach. So think about your last doctor visit. How much time did your doctor spend with you? Did you discuss health habits or nutrition or your lifestyle and your activity levels? Generally, the answer is no. Most doctors only have a few minutes to spend with each client. Not that, they don't want to spend more time with their patients, but they simply just don't have enough time. The doctors today are trained to focus on your sickness. Most conventional doctors aren't trained in the skill set of how to develop a long-term plan to keep you your healthiest and motivated while holding you accountable. So today's doctors have less time for personal interactions and are required to have more in-depth knowledge in a narrowing, declined niche. Additionally, the landscape of healthcare has changed. Chronic disease far outweighs acute illness. According to the CDC, as a nation, we spend 86% of our healthcare dollars on the treatment of chronic diseases. These persistent conditions, the nation's leading causes of death and disability, leave in their wake deaths that could have been prevented and lifelong disabilities or compromised quality of life within this healthcare system. So it rises cost. This is where health coaches can help. Many chronic diseases are preventable through diet and lifestyle changes. Health coaches have the time to support clients in an individual basis. So we have a little bit more time. The primary goal of a health coach is to help clients achieve their health goals. In other words, a health coach provides personalized care. Health coaches not only help clients through their lifestyle and behavior modifications, they mentor, inspire, guide, and motivate to cultivate positive health choices. So when it comes to healthy eating, we understand you already know what is healthy and what isn't, right? However, there are a lot more factors to consider, which is where a health coach comes in handy. Health coaches have the luxury of time that medical doctors don't have to dive deep into the hows, the whys of preventative care. Many doctor offices are even starting to add health coaches to their staff, which is a huge win for patients. Health coaches provide guidance and management for their major components of health, including diet, physical activity, and overall wellness. In short, health coaching is a collaborative effort between the client and the coach. So specific examples of a health coach role may include assessing the client's current health condition, developing health goals for the client, providing counseling services, documenting a client's progress, conducting behavioral health screenings, and establish a client's plan of action. Because without a goal or a plan of action, neither one can be successful. Health coaching utilizes evidence-based clinical interventions, which incorporates a three-pronged approach. One, the best available research evidence bearing on whether a treatment works and why. Number two, expertise to identify the client's individual health state and their individual risks. And number three, clients' preferences and values, because those are very important. Methods of health coaching involve motivational interviewing to facilitate behavioral changes, the goal setting and active listening. Each of these in more detail can be described as motivational interviewing, or MI for short, is a client-centered counseling approach for eliciting behavior change by helping clients to identify strengths and weaknesses for meaningful change. Behavior change refers to efforts to address and change personal habits to prevent disease and achieve wellness. The goal setting, this is important. All of our patients, we try to establish a goal. This is a personal development tool used by health coaches to create an action plan designed to motivate and guide individuals towards a specific goal. Active listening is a communication technique used during sessions where a health coach fully concentrates on what an individual is communicating in order to establish the appropriate plan of action. How many times have you gone to the doctor and you feel like you're not being listened to? That's very important. Many health coaches earn specialized certifications, and there are many different organizations available to choose from for their education. Requirements for various certification agencies differ from with some requiring licensed healthcare professionals or bachelor's degrees, while some support individuals coming into this field without any medical background. Certification is not always required. However, increased, that increases the credibility of the person. A strong background in fitness or healthcare, however, is a must with either whether or not they have a degree or not. Requirements may also vary by state, so check your local regulatory board for more information on this. Many coaches follow a health coaching model. The first step involves establishing a relationship. Building trust through rapport is essential for a successful client-coach relationship. The second step is motivational interviewing for building strong communication strategies. This step helps clients become aware of the personal problems and their limitations. The goal is to focus on the present and to explore the individual core values and their goals. It's important to for the client to express desire for change rather than being told to change what is necessary. So basically, you got to have a desire to want to change. I can't tell you how to change. Lastly, setting goals. The coach will help the client by acting as a guide through goal setting process. This is a collaborative step between the client and the coach. Setting appropriate goals is crucial when helping clients achieve wellness and success. So the role of a health coach, it's important to keep in mind that your health coach may not be a licensed dietitian. Many states require separate license for prescribing specific diet plans. However, a health coach can help you understand the fundamentals of nutrition, nor are health coaches medical advisors who treat medical condition or diseases. The following describes the role of a health coach to facilitate a client's wellness plan. A health coach offers support for client self-management. This can include providing educational resources for helping you solve problems. The health coach can help clients become well-versed in a healthcare system and the medical resources. A health coach is excellent for providing emotional support. A health coach can be useful in building a relationship with medical providers by helping clients keep health histories to provide their medical doctors. A health coach will, thanks, he gave me a blanket because it's cold out here. A health coach will provide support throughout health and wellness efforts made by the client. So health coaches are increasing the demand to help fill in the gaps in traditional medicine. The future of healthcare is refreshing, with the focus moving from treatment to prevention, which is important. While conventional medicine specializes in acute illnesses, chronic disease is now noted as being an epidemic today. Because acute and chronic diseases act differently in the body, traditional medicine simply cannot and does not have the necessary approach in place. Here are a few approaches utilized by health coaches that conventional care simply doesn't have the foundation for. The focus of holistic care, making a personal connection, SMART goals, retraining the brain, self-reliance, and lifestyle habits. So health coaches have the unique ability to focus on the holistic approach. Holistic health is defined as integrated approach to healthcare that treats the whole person, not simply the symptoms or disease. The concept is based on the idea that the human being is multi-dimensional. Therefore, health and wellness approaches need to consider the physical, emotional, social, and the spiritual needs to the person to achieve optimal health. And health coaches do just that. Health coaches work one-on-one with clients to focus on the emotional, physical, behavioral, nutritional, and the lifestyle factors that are needed to enhance overall health and well-being. Another aspect often lacking in traditional healthcare settings is the established bond between the patient and the doctor. Instead, health coaches work hard to provide genuine and meaningful interactions by building respect and trust with their clients. Health coaches take time to get to know the clients in order to help set up the obtainable goal. By understanding the psychological, the behavioral, and emotional needs of the clients, a health coach can provide a truly personalized, client-centered experience. By understanding the lifestyle factors, for example, someone being too busy to cook a healthy meal every day, a health coach can provide alternatives and tips for a healthy eating while taking into account the client's busy schedule. The goal is positive change. Of course, this cannot happen without understanding what the client is and is not capable of. By understanding fitness goals and their style, personal interests, past successes and failures, health and fitness attitudes and beliefs, a health coach can work to establish attainable goals. Goals will be assessed as an ongoing process for both short and long-term objectives. Sorry, my husband has got his drone stuck in the tree. Okay. Goals will be assessed by ongoing process for both short and long-term objectives. The health coach will help you take vague ideas and aspirations and transform them into reality by setting up SMART goals with you. Setting SMART goals provides structure and tractability to help clients be successful. They provide clear milestones and an estimation of the ability to for each goal. Okay, SMART stands for specific, measurable, attainable, relevant, and time-bound. Your health coach will work with you to answer the following types of questions for setting your SMART objectives. What exactly do I want to achieve? That's the major thing. And where? And how? And when? With whom? What are the conditions and the limitations? Why exactly do I want to reach this goal? What are the possible alternative ways of achieving this goal? So health coaches offer support in various ways. One specific technique is to help clients identify negative thinking patterns about themselves and their health to change how they look and they feel. The way you think about yourself and your daily activities, that is very, very important. By identifying the negative, irrational, and erroneous beliefs, health coaches help clients establish positive internal dialogue, and otherwise known as self-talk. Retaining your brain to think more positively takes work, but it's very effective, very effective. By shifting your focus on the positives rather than the negatives, your health outcomes change as well. For example, instead of saying, I hate exercise, remind yourself, I feel great following a workout. See how that's different? That negative thought at first turned into a positive. Over time, your brain will automatically shift to a more positive way of thinking without much effort. At first, it takes a little effort, but the more you do it, the more easy it becomes. It is it's time to experience the power of positive thinking. It's important to understand we all have the power to be responsible for our own health. Traditional doctors are there to help treat your symptoms, but they can't prevent illness the way that you can for yourself. Not even your health coach can do this. You are responsible for your outcome. Your health coach wants to help you succeed and will be there every step of the way, but they can't do the work for you. Instead, a health coach gives you the tools and help that you need to foster an environment for success. Being self-reliant will increase internal motivation and aid in the adoption of healthy habits. Developing a healthy habits and being self-sufficient helps individuals maintain independence later in life as well. Health coaches understand the need for people to feel empowered and can help provide the means for encouraging the very valuable confidence and growth everyone can benefit from. Healthy lifestyle habits can last a lifetime. The better care that you provide yourself, the better care you can provide for others as well. Health coaches enables individuals to see the value in reaching their health-related goals, as well as building a meaningful connection between their lifestyle choices to experience a truly fulfilling life. Behaviors such as foods that you eat, the amount of sleep that you get each night, and how physically active you are have a significant impact in your health. Each of these behaviors can either positively or negatively affect your overall health in a significant way. Ultimately, a health coach will enable you to take ownership of your experience and create positive, lasting lifestyle changes. When conventional medicine began, the aim was treating acute infectious diseases such as tuberculosis, typhoid, and pneumonia. Today, however, chronic diseases attributes to 7 of 10 deaths in the U.S. Acute conditions are sudden and often severe. Examples include anything from a broken bone to asthma attacks. Chronic conditions, on the other hand, develop and worsen over an extended period of time. Heart diseases top the list, followed by cancer, chronic low respiratory diseases, stroke, and diabetes. Many contributing factors to chronic diseases are preventable. For example, lifestyle influences such as diet and exercise. Fortunately, health coaches address both of these for you. The Center of Disease Control Prevention reports over 1/3 of American adults are obese. Among children and adolescents, 17% have obesity. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer, some of the leading causes of preventable diseases. A number of studies have shown health coaching to be effective in helping individuals lose and maintain weight, and in turn, lowering the disease risk. Many even report decreased confidence in weight loss. Increased increased confidence in weight loss when working with a health coach. Health coaches don't focus exclusively on things like calorie reduction or increasing physical activity. However, they teach the fundamentals of behavioral modification and clients in overcoming the mental barriers that keep them from achieving their weight loss goals. The key to success is attributed to health coaches' ability to effectively encourage clients to make a permanent and positive change in their lives by committing to living a healthier lifestyle today, tomorrow, and the rest of their lives. The CDC reports that about 610,000 people die of heart disease in the United States every year, which accounts for 1 in every 4 deaths. Furthermore, heart disease is the leading cause of death in both men and women. Risk factors for heart disease include high blood pressure, high cholesterol, and smoking. The sad truth is nearly 50% of Americans have at least one of these 3 risk factors. Other lifestyle factors can also put people at a higher risk for heart disease, including overweight and obesity, poor diet, physical inactivity, excessive alcohol use, all of which can be improved and managed with the help of a health coach. Studies have shown patients in a coaching program achieve a significantly greater change in total cholesterol, as well as improved secondary outcomes such as weight loss, increased exercise, improved quality of life, less anxiety, and improvement of overall health and mood. Cancer is the number 2 cause of death in developed countries and number 1 in underdeveloped countries. Scientific experts worldwide agree that at least half of all cancers and cancer-related deaths are preventable, whereas only 5 to 10% of cancer causes are from genetic link. Cleaning up your diet, exercising, and regularly detoxing are extremely important for achieving optimal health and reducing your risk for cancer. Surprisingly, sleep deprivation has also been linked to having a higher risk for cancer. When it comes to cancer, what you eat matters. The most common cancer-causing foods include refined sugar and flour, soda, microwaved popcorn, food in cans produced with BPA, grilled and processed meats, and hydrogenated oils. The food choices that you make every day can raise or lower your personal cancer risk. And a health coach can help you remove known offenders from your diet. The CDC reports chronic lower respiratory disease, also known as chronic obstructive pulmonary disease, as the 3rd leading cause of death in the United States. While exposure to air pollutants in the home and workplace, genetic factors, and respiratory infections do play a role, tobacco use is a key factor in the development and progression of chronic respiratory diseases. The number of studies have shown positive results with interventions by health coaching as tobacco cessation programs. One study concluded 32% quit rate among participants who received regular coaching. A health coach can help smokers, get ready to quit, support smokers through the quitting process, help smokers stay smoke-free. Stroke is the 4th leading cause of death in the United States and the leading cause of serious long-term disability in the United States. Nearly 1/4 of strokes occur in people under the age of 65. Studies report many stroke survivors admit to feeling overwhelmed by treatments recommended by their healthcare providers. Evidence show that participation in programs that teach their self-management skills and education can improve quality of life and self-efficiency after a stroke, which is where the health coach can help significantly. Health coaching helps to enable individuals to improve and manage their stroke recovery with access to individually centered and practical support when needed. Stroke prevention can also be achieved with the help of a health coach. The primary risk for stroke is hypertension or high blood pressure, which can be managed through diet and exercise. A health coach would recommend recipes low in refined white salt, as well as ways to boost your fruit and veggie intake. Other changes a health coach may recommend may include limiting your alcohol intake, regular exercise activity, managing your stress, maintaining a healthy weight, and again, smoking cessation. Several studies have shown that health coaching can be effective in improving various aspects of type 2 diabetes. More significantly, it has been shown to have a positive effect on patients' knowledge, skill, self-efficiency, and behavior change regarding the type 2 diabetes improvement. The CDC reports type 2 diabetes accounts for about 90 to 95% of all diagnosed cases of diabetes in adults, but is largely preventable. 1 out of 3 adults has pre-diabetes. However, 9 out of 10 of these people don't even know they are pre-diabetic. Significant risk factors include age, excessive weight, particularly around the waist, family history, physical inactivity, poor diet, and maintaining a healthy weight and regular physical activity are known to significantly reduce the risk for type 2 diabetes. The Diabetes Prevention Program found that weight loss and increased physical activity reduced the chance of prediabetes turning into type 2 diabetes by 58%. So we're going to wrap it up. And I want to thank you all for taking the time out tonight to join me outside because the weather is beautiful. And we really love to connect with people and coach them on a healthier lifestyle. And if you are interested, you can definitely go to our website at functionalmedicinekc.com and schedule your discovery session. Thank you so much for joining me tonight.